2 years into the pandemic, what's happening in Hong Kong looks more like the first 2 months. Patients wheeled out onto the street as hospital capacity is overwhelmed. The city's dynamic zero COVID strategy is failing, and it's bracing for the worst.
As far as Hong Kong is concerned, we need to find our own way out of this epidemic. It has outgrown our capacity.
Hong Kong has been closed off from the world since the start of the pandemic. It had done well as a result, recording just over 200 deaths, with a series of partial lockdowns and restrictions on gatherings. The city bought itself time, but it did not spend it well ahead of Omicron's arrival. The vaccination rate among the elderly is very low, and hospitals have been overwhelmed because mild and even asymptomatic COVID cases must be sent there.
They actually don't need any medical help, but people who are just panicking, they are panicking because there are so many of them, thousands. So we just could not accommodate them in the hospitals.
Hong Kong has trod a middle path between the Western and Chinese approaches to lockdown. Now it seems to have the worst of both worlds and will have to choose one definitively. Chinese President Xi Jinping has made a rare public statement to order that the overriding mission for Hong Kong's leaders is to stabilize the outbreak. That suggests the ultra-strict lockdowns of the mainland may be enforced on the city. As the Western world emerges from the COVID storm, Hong Kong is right in its middle. Tom Cheshire, Sky News, Beijing.